Assalamualaikum dear doctors. In this video I am discussing communications about tuberculosis. So there are two exam scenario come. First one is latent tuberculosis and the next one active tuberculosis. So the task of latent tuberculosis is talk to the mother of a 14-year-old girl with positive Mantoux test and normal chest x-ray after TB contact. Explain the result and management. And number two is that active tuberculosis, that is 14-year-old boy has symptoms of tuberculosis, cough for 2 months. The NAAT test was positive. His father is a smoker. Talk to the mother about treatment and management. Now, explanation of tuberculosis. Tuberculosis is a disease caused by a bug which is weak but smart, hides itself under the cells called Mycobacterium tuberculosis. Tuberculosis usually affects the lungs but can affect other parts of the body. Symptoms are fever and night sweats, cough for more than 3 weeks, losing weight, blood in your sputum, that is phlegm. Now, how it spread? The spread. The germs gets into the air when someone who has infectious tuberculosis coughs, sneezes, talks or sings. Usually you need to be in close contact for a long time with someone who has infectious tuberculosis to become infected with the tuberculosis germ yourself. Next, what is a contact of tuberculosis? So, a contact of tuberculosis is someone who has spent a lot of time with somebody who has tuberculosis. Each situation is different and will be assessed by the Department of Public Health. What is the difference between the latent tuberculosis infection and active tuberculosis disease? The answer is when tuberculosis germs first enter your body, they cause latent tuberculosis infections. This means that the germs are asleep in your body. If you do not have treatment, latent tuberculosis infection can become active tuberculosis disease. If contact, the doctor will take your medical history and carry out tests. The first test is usually a skin test that is called a Mantoux test. It involves a small injection into your arm. The results of this test will be read in 2 to 3 days. The doctor will decide what other tests you need based on this result. Now, treatment of tuberculosis. The doctor will give her 4 antibugs. First 2 months will be 4 antibugs, then second 4 month will be 2 antibugs. It can be available in one tablet. Now, special message of tuberculosis. Tuberculosis contact tracing. The doctor will take your medical history and carry out tests. The first test is usually a skin test that called a Mantoux test. It involves a small injection into your arm. The result of this test will be read in 2 to 3 days. The doctor will decide what the other tests you need based on this result. Advice. Patient or parents and GP of indications for seeking advice: fever, malaise, vomiting, jaundice or unexplained deterioration. Consider coexistent viral hepatitis. If AST/ALT level rises to 5 normal, stop treatment and seek advice, alternate regimen. So this is all about the key points of communication tuberculosis. Please do subscribe and share. I'm RCPCH with Dr. Emma Chaudhary. Thank you.